Dr. Bayo, it is lovely to see you again. And this is the first time you and I are actually doing a true podcast. We did a panel at South by Southwest 2 years ago that was about podcasting, and we turned it into a podcast. But I'm so excited to have you on my show. So welcome.
Thank you for having me, Erin. It is a pleasure to be here with you.
Well, it's a pleasure to have you here. And so I want to start with my first question, which is I've done a lot of podcasts in the past with people that are in the healthcare space. I always love to know people's backstory, and I don't think I've actually ever gotten this from you. I have a guess as to what it might be related to, but I'm not going to spoil that. So, uh, tell us how you took the journey and landed in the world of healthcare.
By watching what my father had to navigate, he was a triple war veteran, World War II, Korean, and Vietnam, and he passed away at the age of 99. And as a child, watching him have to navigate the healthcare system, be questioned when he would just try to get care, and all of the barriers and challenges that he had to face really fueled me fueled me to see what can I do to change healthcare in a new way and really make it patient centered. And so I thought the best way to do it is to become a physician. And I had a real non traditional journey into healthcare, which I think has helped me really have this kind of team approach. So a lot of people don't know I was a CNA, a certified nurse assistant, for 2.5 years. So I changed people in the bed. I helped people get to the restroom. I did so many different things, helping whatever nurse I was working with to provide the best care possible. And then I went to PA school, which is a physician assistant. And through that journey, working as a PA with urgent care and family medicine, I just felt like, "Oh my, I wanna do more, I wanna learn more." Even though, I had a great job, I just felt like this wasn't the stopping ground for me. There is so much more that I could do. And so, I left my job. It was a huge risk. Of course, applied to medical school, left my job, went to medical school, did all 7 years, and it was the best decision, I could have ever have made because it allowed me to be able to, learn more, do more, and help as many people as possible. But that journey, all credit goes to my father, who I saw have to navigate healthcare when he served our country. And not only just served it during a segregated war in World War II, and was questioned every time he sought care. So I thought, what can I do to be able to help people? And that's what I get to do. And who would have thought, full circle, going to different events, going to different rallies, or even just showing up in the clinic with him would really be the blueprint of what I was meant to do, which is to help people. And so that's where that journey lies.
Two things in response to that. So thank you for sharing that beautiful story. One, not surprised at all your dad was part of the inspiration because I know you and I have talked about what a great man your dad was and is, and I'm sure is looking down upon us right now and smiling at you for doing this podcast. And two, knowing that the nursing training and the physician's assistant training makes complete sense to me because I think as our listeners are going to learn, anyone that hasn't had the experience of Dr. Bio yet, you're just such a nurturer. And based on what we're going to talk about, they'll realize just how much you do and why you're a perfect guest for this show. So, with that, I mentioned in the intro, and if anyone looks at your profile, they'll instantaneously figure out a lot of the fact that you wear a ton of hats, not physically, but metaphorically, right? And you seem to do all of them well, which is the most impressive piece. So you're a mom, first and foremost, two beautiful girls. You're a family medicine doctor, the medical director of both St. Mary's Urgent Care in Reno, as well as, and I'm going to butcher this, but the is it Washoe County Sexual
Yes.
Response Team? A contributor to national news on the regular as a court, like as a guest, right, to talk about particular topics, keynote speaker, podcaster, columnist, and I believe if we're able to talk about this, a soon to be book author. Then on top of that, just in case that wasn't enough, you're also an avid content creator and you do it really well. How do you find the time to do all of these things?
Like you said, I do. I wear many hats, but there is a level of intentionality with each hat that I wear, and that is the opportunity to show up where people are. And I give the example. A lot of us consume information in different ways. So if I can have many touch points, whether it is through social media or you might hear me speak or actually see me in the clinic because I am a practicing physician. I love that. And I love being able to help people in different areas. Now, how does that happen? I get a lot of support and I am so grateful. My biggest supporter is my husband, and I want to give him credit. And if he was listening right now, he would turn bright red. He will when he listens to this. And so, my husband, he has a full time job, but at 1 a.m., he's helping put together the videos that you see on Instagram. He's editing, he is just been the best and the biggest supporter I could ever ask for. And that in itself has just been really the catapult or the catalyst to help me kind of be where I am. And the other parts that I cannot forget is I have a fantastic director of marketing. Elizabeth has just been an amazing asset to my team. And when you have people around you that not only believe in you, but support you, but can also just like help you grow, it is a wonderful win-win on both sides. So all all the credit goes to the team that helps me help more people. And that's how I'm able to do that. And with my girls, they're part of the journey as well. They are with me with a lot of things that I go to. And I think that has helped me kind of wear these many hats. But in the end, my family comes first, my girls come first. And I think that's how I'm able to kind of bounce around and just know whatever I do choose, if I work with you or if I'm a part of your organization, it's because I genuinely believe in it. I believe that I can possibly help and that you are trying to help others.
Well, she speaks the truth, and I've met her husband and I met Elizabeth before, and they are lovely people. I've actually broken bread with them at South by Southwest, so I can attest to how great they are. Um, I want to ask you a follow up question, though, to the content creation piece, because it's one thing to create it, and you do an amazing job, and your husband does an amazing job, and Elizabeth does an amazing job. But you have a huge audience. I can't even remember how many hundreds of thousands or millions you have. How do you engage with them given the fact that they're so big and obviously one of your greatest assets is your authenticity?
The first thing is actively listening to what they would like to hear about. What would they like to learn about? What are the questions that they have? And how I'm able to do that in such a intentional way, although the audience is so large, is leading with authenticity, but also removing judgment. I do the same thing in my clinic, and when I'm doing let's give an example. When I work an urgent care shift, I might meet 50 people in a 12-hour shift that have never met me. And if I can walk into that room and lean into listening first, not judging, and then allowing you to share whatever intimate issue you have, I can help serve you the best way possible as a physician. So, with my audience, I do the same thing and really provide a level of conversation, intimacy, dialogue. Even though you've never met me in person, I see you, I hear you, and I'm grateful to have the opportunity to just try and help share information in your space, wherever that may be, in your car, at work, even if it's a 15-second video that you got to see. Thank you for inviting me in. And I take such pride with it as well.
All of that is clear. And I want to talk a little bit about one of these passion projects where you do invite people in. And the other day I was listening to your podcast, and we'll talk more about that in a second. But you mentioned that the guest that you had on, and her name is Tina. I am not saying her last name because I would butcher it. You did a gorgeous job. I would not. You met her at South by Southwest, which is this huge innovation conference that happens in March in Austin, Texas every year. And have you ever heard of this thing called a phenomenon called the butterfly effect?
Yes.
Okay. So the thing that got me thinking as I was out hiking, listening to you podcast and mentioning that you had met Tina there is, I had asked our mutual friend Dan Kendall of the Health Podcast Network, who my last podcast was on, your podcast is on. And I wanted, because I was building a panel for South by Southwest, other healthcare podcasters to speak on the panel with me. We were talking about podcasting and healthcare. He introduced me to you, which I'm very grateful for. You came to Austin, where we met in person and hung out, and I met your husband and others. And then the thing that was really crazy is I think that same year you got a chance to meet Samantha Ski of She Media, who's been on the show, Katie Couric, who I've also interviewed on previous show. You were introduced to my wife. My wife met Dr. Mariko. Both of you have been hugely helpful. So isn't this crazy how this works?
It is. I believe in the butterfly effect. It is amazing when you think of like the 6 degrees of separation. Well, it's like, yes, but no, because all of those dots ultimately end up connecting in a beautiful place. And sometimes you don't even know that journey, but all of a sudden you're like, wow, this is fantastic how this one person led to this person. And then we were able to innovate and create a beautiful project. And when I think of the podcast, it's been around for 3 years. And in the last year, we relaunched it and really focused on patient advocacy. And that episode with Tina was a beautiful conversation because you not only get to hear about a health topic, which she has, Crohn's disease, but we also layer in it's a chronic illness. And then we talk about the cultural aspects to dealing with a chronic illness. And she has an ostomy bag. So for those who don't know what that is, when you have an area of your colon that is no longer, I guess the best way, her colon was inflamed, it was no longer able to function. So the surgeon will actually go in, remove a piece of that colon. And if you don't have enough to kind of connect, or if it's better served that you actually remain having that colon separated, you wear what we call an ostomy bag. And so she wears a bag that allows her colon to function, and that means she has to actually defecate in a bag. And I know those words are hard for people to hear, but that's why these types of conversations are so important. And what she goes through minute by minute, hour by hour, not only with her illness, but with having to navigate this in a culturally difficult way where she shares food is a part of her culture and she has to be mindful of what food she chooses. And that can be a stigma. So, in that episode that I talked to Tina about, there are so many gems in there that I feel will resonate whether you have a chronic illness or not, whether you are someone who is trying to navigate different cultures that you are dealing with, and you have your own illness. So it's been wonderful to relaunch this podcast and really speak to more people and give them tips that they can take away. But that butterfly effect is strong. And to your point at South by Southwest, first, I just want to say I am so grateful to you for that connection that Dan made with you and I. It was an instant connection. We jumped on and I'm like, hello. And you're like, are you always like this? I'm like, yes, I am. And then in person, we felt the magnets, the effect as well. So yes, I believe in the butterfly effect and it's been wonderful. And one more thing that's really interesting that we talked about with Samantha. And I always tell her this every time I see her. I sent her a cold LinkedIn message sharing my TED Talk Do No Harm. And I said, please just take a look at this. And for her to take the time to look at that talk and then reach out to me and say, I'd love to collaborate with you. And we did. And I started writing for it. Then you provide the opportunity to be at South by Southwest. And finally, I get to meet her in person after writing articles for her. That is a beautiful thing. And again, all of those dots connect and you're like, oh, she's my friend. I'm like, she's a lovely human being. So yes, so
Well,
many things.
it's the way it's meant to be, and, I do wanna clarify or make a, statement. One, that when I did meet you and I asked you, "Are you always like this?" It was a positive thing,
Yes.
not a negative thing, but you had a lot of
No, it
energy,
wasn't.
and I loved it. And the other is her podcast is called Beyond Clinical Walls, which, by the way, coincidentally aligns with BCW, which is her full name, Dr. Bayo, Winchell, but she goes by Dr. Bayo, and so Given your talents and training as a doctor, knowing you could do a million other things, some would make you a ton of money. Not that, you're not making some money off of some of your endeavors, but you've chosen to give back to society in a lot of ways, but your podcast and your social media content and your volunteer work. One of the new questions I'm asking guests is like, how does providing these gifts to the global community make you feel as an individual?
Makes my heart so grateful. Um, when I decided to become a doctor, I knew I wanted to help people. And I knew that I don't follow the traditional beat, the traditional path of doing one way, one thing in one direction. I've never been like that. And to have the opportunity to give back to my community, not only here in Nevada, but worldwide, um, it makes my heart so full to get to do what I know I'm supposed to be doing, and that's why I became a physician. So there is a level of gratitude, there is a level of um, just I'm so grateful to get to do what I get to do, and I take it, to heart every day, whether I'm putting content out, you see me on television, whatever I do, that level of gratitude is continuing to circulate, throughout my entire body.
Well, we are grateful as well. And so it's a nice two-way street. I do want to talk a little bit about the book that I mentioned up front. And I don't know how much we can talk about it because we didn't really cover, although I did let you know I was going to ask you the question. So can you tell us about the book deal? What's it about? What's the timing? All those good things.
Yes, and I am thrilled for this amazing opportunity. I have been signed by Penguin Random House, specifically the imprint The Open Field with Maria Shriver, and the book is titled How to Talk to Your Doctor, and it's a book that will help people not only navigate the healthcare system with a behind the scenes as a physician, lifting that veil of what is happening behind the which we know is broken and fractured. But I take it a step further. I highlight what you can do, whether you're in the middle of an emergency, whether you're a caregiver, whether you're just going for a checkup. I give you the language, the tools to get the best care possible. Whether you're talking to a doctor, whether you're talking to a social worker, it's wonderful. And the other piece is sharing how to understand your body more, how to understand diagnosis, but putting the two together is such an amazing opportunity that I get to help people across the world. So, yes, how to talk to your doctor, and it will be live June 2026. And so it's coming up,
I
and
was
I'm
hoping you were
so
going to say June
excited.
of this year, but I will take June of 2026.
Yes.
And I love the fact that you're pulling elements of what you talk about on the podcast, getting your guests to share their best tips, helping people, better understand their body, how to navigate the healthcare system. I thought the tip that Tina gave about really understanding how insurance works and being to be a pro in that, like what a good tip that was. So one last thing, before I forget, so that we don't miss it, because I know we're tight on timing. Where can people go to find out about you, your book, all of the things that you do? I think I know what the answer is, but I want to hear it from you.
Yes, please check out my website, doctor.bio. Spelled out all the way, doctor.bayo. You can also check out my Instagram handle as well, which is doctor spelled out dot bio as well. LinkedIn, TikTok, I'm on all the channels, including YouTube. And of course, check me out at Health Network Podcast too. I love that platform. Yes, so you can find out. I'll be taking followers along with me about the journey of writing this book. And the nice part is whether you see an Instagram video, you hear the podcast, you see me on television, this book really embodies the work that I've been doing for years. And so to be able to put it forward in a book so people can have it with them wherever they are is such an amazing opportunity, and I'm excited. So, yes, please check out all of those channels.
Well, thank you for sharing that, and I better be on the early review process because I would absolutely love to get a copy when it's ready. And
You
the
are.
last thing I want to ask you before we get into a few fun questions and then let you go is, You are genuinely always such a ray of sunshine. This is what I was referring to when I asked, "Are you always like this?" And what I've seen is you are always like this, but what's one thing, knowing we're going through some difficult times, one thing you'd like to share with our listeners to help them stay positive and to share that same positivity with people who surround them?
There's a common thread when you know me and you see the positivity or just how I approach the world or even just my everyday conversations is truly is gratitude. I believe in it. I immerse myself in it. I use a great example is I think about how somebody else might be going through an experience that is much worse than what I'm going through. And when I see patients who have a family member who's lost their life, who's been diagnosed with a terminal illness, and how I feel so fortunate to have my health and be able to see my family. All of those things allow for a reset. And I always think about how I can turn that situation, if it's challenging or negative, into something positive. So I'm always looking for one thing that is positive out of all of it. And sometimes it can be hard, but I promise everyone listening, even in those dark times, and if you take a couple of seconds and you allow yourself to just see what's one positive thing that came out of this, it can allow you to kind of just reshape that narrative, that internal dialogue that might be going through your head, and come up with a new plan, a new step forward. And all it takes is that one step that helps you kind of regain a new perspective, momentum. And that's what I live by, gratitude. And that's what my dad mirrored for me, where he would have difficult days, but he would say, I woke up. I woke up. I got to open my eyes, Bayo. And that is a gift because not everybody gets to do that.
I love how prescriptive that is, and so definitely words to live by. I'm gonna try to take a note out of your or a page out of your book. Now to the funner questions, and I'm really curious to see how you're gonna answer these. I always am with all the guests, but what's the dirtiest sounding word that isn't actually dirty?
Asian. Hear my voice just cracked on it. Oh my. So you can always tell how it comes out if I feel it or not. So sorry. So mastication is actually the medical terminology of chewing, but it's so dirty. Like I can't, I like mastication. So that would be one of the dirty words.
Well, it's a good one, and it's funny that you say this because we had a guest on recently, Dr. Joseph Wu, who was the former president of the American Heart Association, and he gave me three, and that was actually one of his words. So clearly, doctors have their own dirty words that aren't actually dirty. So, and thank you for the definition. I do also know you've met a number of famous people over the course of your life. We mentioned a few of them earlier. I know you actually did a panel or a fireside chat, I believe, with Chelsea Clinton recently at the health conference. Who has impressed you the most out of all these amazing people that you've met?
I've met a lot of celebrities and had fantastic conversations and forms really amazing relationships. But the first person that comes to mind is Brooke Shields. I had the opportunity to do a campaign with her and I met her multiple times. And through each interaction, she was consistently kind and um, intentional with wanting to know a little bit about who I am and what I stand for. And I also really love her recent book that she put out, where she talks about some of the dismissal, how she was gaslit, all of those things, even in a celebrity status. And so when I add just who she is as a person, and then the books and the other things, and knowing that there is a continuity or a continuum of kindness and being thoughtful, it really puts her at the top of my list as far as just a genuinely kind human being. But there's been others that I've met as well. Little John, whose mission and passion is to raise awareness about colon cancer and the importance of getting a colonoscopy and mental health. And yeah, those are just some. And I can't forget Katie Couric as well,
Katie Couric's a
who
good
is
one. Yeah.
just an amazing, kind human being who is what you see. And so those are just some of them, some of the conversations that I've had.
Well, those are some good ones, and it's nice to hear. I've heard similar things about Brooke Shields, and I think Samantha Ski brought her up. We have two more questions, and then I know I need to let you go. So, your biggest regret?
My biggest regret is not recognizing that I actually have ADHD sooner. So let me give context to that. We talked about I work in multiple hats. I do multiple things. And I I think in the earlier stages, I was just like, well, I'm a little different, which I am, but not recognizing that this is a secret, like this is a superpower. Um, a good example is when I'm doing an urgent care shift, I have 4 rooms running, sometimes 6, and I can tell you every single thing about every patient I'm seeing. And that is a great superpower. Now, sometimes, I may not remember to pack a lunch for my kid or do, it's whatever today was rodeo day and I forgot to dress my kid in rodeo day. But I think the biggest regret is allowing more grace to myself to know that this is a cool thing that I have, but just understanding that diagnosis sooner, and realizing, where it lives and how it lives, and that's okay. So that would be one of the regrets, but it's a superpower.
It truly is, and I appreciate you sharing that. And we do have one last one, and then we will let you go because we're just about at time. Name one band you wished you had seen in concert.
This is recently Beyoncé. I was in Amsterdam. I just got back and she was in London and I didn't know. So I wish I would have been able to plan that. I think she's just an amazing entertainer, an advocate, all the things. So that would have been that's the recent concert that I wish I would have been able to
I have a
be.
funny feeling you're going to meet her at some point in time, so that will all go to the wayside. And so, with that, we will conclude our conversation. Thank you so much, Dr. Bio. It's always a pleasure. For those listening, please take time to listen to her podcast. Go and check out her content on TikTok and Reels. Read her book when it comes out. I promise you, it will be uplifting, and you will learn a lot about the healthcare system. And she's just such a great advocate. So, thank you.
Thank you, Erin, for having me. I'm just grateful for the fact that our paths cross, and I just want to thank you for being you. Like, you are such a delight. You are an amazing force of connectivity that allows people to really have their dreams come true. So I want to highlight that.
Well, thank you. You may have just given me my ad promo for my show. So, with that, I will let you go. So, thank you so much. If you don't mind just waiting 1 second while we let the audio upload, and then I will send you on your way.